So let's talk a little bit about pain management after surgery. This is obviously one of the major concerns that most patients appropriately have because, let's face it, surgery is unable to be done without some pain involved. Our job is to minimize that as much as possible for patients. And one of the things I always try to emphasize to patients is that nothing that we do totally eliminates pain aside from general anesthesia. What pain management does, whether it's pills or shots or nerve blocks or cold therapy or everything that we do, is designed to get patients through time. And time is what stops pain. So we make pain tolerable during that time when your body finally heals itself and the pain drops down naturally. So we use a combination of things when patients come to surgery for pain. First of all, let's talk about the anesthesia. The anesthesia that we use typically for most patients nowadays is a spinal anesthetic plus sedation. So patients will have sedation so they're sleeping happily the whole time and they won't be able to hear anything or see anything. And a spinal block will make them numb from the waist down so they won't feel anything either. And there's no chance that you'll wake up and be not anesthetized and have terrible pain because you're not going to be all the way asleep. And you'll be able to tell the anesthesia doctor if you feel something going on, which is very, very rare. Sometimes, if patients can't have a spinal anesthesia because of either previous back surgery or severe back arthritis, or perhaps they just had a bad experience with the spinal in the past, we will use a general anesthesia, which is fine. The downside of a general is that some patients will wake up feeling more groggy and perhaps a little bit more nauseated, and that makes it a bit more difficult to get up and get moving, especially if patients are in the ASC outpatient setting. But for certain patients, if we know up front that we are going to have to do a general anesthesia, we'll simply do the surgery at the hospital, and therefore they can stay overnight if they need to recover from that general anesthesia. But again, most patients don't have too much problem with that either. As far as pain medicine goes after surgery, we use a combination of different modalities to try to relieve pain and get patients through time so that their body pain goes away by itself over time. Typically we'll use a narcotic pain medication. The default that we'll use is something like oxycodone, not OxyContin, which is the one you've heard about in the news, but oxycodone, which is the short-acting narcotic. And we'll use that as our baseline pain medication, and we'll supplement that with an anti-inflammatory medication. We'll also use Tylenol, which is helpful. We will also use sometimes a medicine called gabapentin, which is a central nerve pain medicine that works in the brain to help with pain. And then we will also sometimes add on top of that, during the surgery, we'll inject long-acting local anesthetic pain medicine into the soft tissues around the knee to help cut the pain down for the first day after surgery. Finally, in the recovery room, we will have one of the anesthesia doctors put a nerve catheter into the thigh muscle. It's a little tiny catheter that goes right next to the nerve that goes to the front 2/3 of the knee. And we attach that to a disposable small pain pump, and it's filled with Novocaine or a Novocaine-like medication. And it's a little plastic grapefruit that squeezes itself smaller and smaller and smaller over about 4 days, and it drips that Novocaine material into the catheter right next to that nerve and keeps that nerve deadened for that 4-day period. And that tends to cut pain about in half. Not all the way, but about in half. And so most patients need less narcotic pain medicine to feel comfortable, and that's nice because we worry more about narcotics, not so much about addiction in the short term, but we worry about the side effects like nausea, constipation, feeling drowsy or feeling goofy so you might fall and hurt yourself. And so being able to cut back on those medications is really nice with that pain catheter.